Thanks so much. I'll be presenting a topic, assessing knowledge, attitude and practice of healthcare professionals with sexual reproductive health and HIV services integration in Oyo State, Southwest Nigeria. And I'm going to start with the abstract. Integration of sexual reproductive health and HIV services is said to be poor in Nigeria, but it is very important because of the benefits to both the clients and the health providers. However, successful implementation of integrated SRH and HIV services depend greatly on adequate awareness of knowledge, positive attitude and best practices of all personnel involved in the system in service delivery. The study showed that providers actually have average knowledge of integration, and in the course of the study, respondents 414 of them were taken from 65 health facilities from 20 local government areas in the 3 senatorial districts in the state. So from the study, the participants were also shown to exhibit positive attitudes towards the program, but were poorly motivated because in the course of study, we actually found out that most of the professionals working on the integrated services are not really paid as at one due. They also show best practice towards service delivery because they actually counsel their fellow professionals to participate in rendering the services to the patient, and they also encourage the patient visiting the facility to also participate in collecting the integrated services. From the study too, retraining of healthcare workers was found to be hopefully very necessary to enhance the skills of the providers to perform the integrated services successfully. So the brief introduction is seen here. Improvement in the health of the people depends greatly upon awareness and care of professionals working on integrated services, and also addressing reproductive health and HIV together will better serve the needs of clients and healthcare providers in a more comprehensive, cost-effective and efficient manner. Integration was also said to for both services has been proposed to enhance service delivery. One of the constraints of the providers is, however, poor knowledge and attitude to integrated services, but they are very critical to the success of the program with their key roles to successful implementation. So therefore, the study is designed to assess the knowledge, attitude and practices of providers or integration services. What are the statements of the problem? Basically, we know that the services integration in Nigeria is poor, despite the tremendous benefits to clients and services providers of the system. And a major constraint to this integration is the level of cap of healthcare providers. Hence, there is a need to ensure functional and effective sexual reproductive health services integration, which justifies this assessment. The justification: integration of SRH and HIV services is very important to successful implementation of public health intervention in the country, even though we have poor resources. Cap of providers is one of the challenges facing the system. Therefore, the assessment of level of knowledge, attitude and practice towards integration of services program is highly justified. The objectives is as shown, basically to determine the level of cap, knowledge, attitude and practice of healthcare providers on integration of services, and also to come up with recommendations that can better integration in the state and the country. The methodology: the study locations was in Oyo State and health facilities in 20 local government were selected. The study population were health workers working on SRH and HIV integration services in select facilities, and the study design It was a descriptive cross-sectional research design which is always employed to assess gap of healthcare providers on integration of HIV and sexual reproductive health services. The sample size dissemination was the formula that was obtained by Liu Huang, and the sample size calculated was minimum of 401, but 414 respondents were selected so as to account for those respondents. Then sampling techniques that were used were multi-stage sampling, and a sampling time frame was generated that was stratified into 3 levels of cases. Simple random balloting was used to select 2 comprehensive health facilities, then 5 general hospitals and 57 primary health care facilities in the 20 local government areas across the state. And in the selected facilities, consecutive sampling was carried out so select participants who met the inclusion criteria. Some hypotheses were also generated. I want to know if there are no association between social demographic characteristics such as designation and cap of integrated services, and if there are association between social demographic characteristics and knowledge, attitude and practice of SRH with the level of significance set at a 0.05. The data analysis employed was all questionnaires were numbered for the purpose of tracking after each day's job. Then the questionnaires were sorted and kept in a safe place for confidentiality. The data obtained were entered into SPSS version 21 for analysis. Data dictionary were also developed for questions in the questionnaire to aid proper analysis, with the level of statistical significance set as is less or equal to 0.05. Ethical approval for the program was also sought from the Oyo State Ministry of Ethical Research Committee, Ibadan. The questionnaire that was used was actually interpreted to our local dialects to improve comprehensibility of the respondents. The reports obtained showed that most of the people, most of the respondents were female, and about 92.8% of them are from public health facilities, and the age group with majority of respondents was 33.6 to 31 was 33.6%, and they were 31 to 40 years. The participants are basically 80.0 female, mostly Christian, Yoruba ethnic group. 32.6% of the respondents are nurses, midwife by designation. Then there are some other analysis that was carried out. I did an analysis on the attitude of workers to integration, and I found out that more than half of them have positive attitude to service integration in the state, which is can be said to be excellent. Only 22.7% of them have negative attitude to integration. On the practice of healthcare providers to integration, 64.7% of them have a very good best practices toward healthcare providers integration, while 35.3% of them have bad attitude to practice. On the association between designation and CAP, there were some of the templates that were not updated there because I give the organizers of this e-conference to re-upload additional slides for me to use in this course of presentation, but I can find out that they did not upload it fully. So let me just rush through it from the hard copy I have here. I also did an analysis on the association between designation and knowledge, attitude and practice of the respondents, and I find out that the knowledge, from the knowledge aspect, the chi-square was 11.549, while the p-value was 0.483. So there is no significant association between the designation of the respondents and the knowledge of the respondent, as we can see from the soft copy here. Then another association was also done between designation and attitude of the respondents, and the chi-square score was 21.176 with p-value of 0.02, which is within the p-value of 0.005 set in the course of the analysis. So it shows that the respondents have positive attitude towards integration, but from the analysis too, I can see that the workers that have the most positive attitude towards integration are the community health extension workers, while the medical doctors have the least positive attitude towards the integration, as can be seen from the hard copy of the analysis that was done here. This might be because of the number of the respondents that fell into different categories of designation. Another association was also done between the designation and practice of documentation. The chi-square of that was also found to be 13.911, while the p-value was seen to be 0.031. So yes. Hello. So I can see that the respondents have positive practice attitude towards the integration services. Then on the discussion, hello, can you hear me? Hello? Hi, can you hear me? Hello? So
Tomori,
from the discussion aspect, for the first subject, yes?
Mr. Tomori, can you hear me?
Hello?
We couldn't hear you.
Hello? I can hear you. My internet is okay.
I hope there is a
Can you hear me now?
issue from your side.
Hello? My network is very good. I can hear you. It's good. Hello?
Tomori, I can't hear you.
Hello? But the participant said they can hear me. The network is good there. I can hear you perfectly. Hello? 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 Okay, others can hear me. Let me continue. So from the study, I write some discussion on the first objective: determine the level of knowledge of healthcare providers on integration of sexual reproductive health and HIV services. These respondents were found to have average knowledge of integration to sexual reproductive health and HIV services, and also the knowledge of the workers to documentation practice in the state is very poor, and that might be the factor responsible for the poor degree of respondents to sexual reproductive health in the country. Then from the study, I found that there is significant relationship between designation, and attitude and practice of integrated sexual reproductive health and HIV services. And this concur with already existing literature that said highly skilled personnel and should be recruited to public facility and they are exposed to more capacity building opportunities. On the issue of assessing the attitude of healthcare personnel towards integration of sexual reproductive health and HIV services, most of the respondents have positive attitudes towards integration, and this was corroborated in other similar findings. To evaluate the practice of healthcare practitioners on integrated SRH on integration of sexual reproductive health, respondents exhibited best practices on integration and the documentation using the required tools, though their knowledge can be improved further. In the recommendation, retraining of providers on integration is recommended, health promotion and education is recommended, infrastructural upgrade and staff increment is also recommended. For
Yeah, please conclude your.
Yes?
Yeah, please conclude your.
Hello? Okay, conclusion. Successful integration depends on adequate cap of healthcare providers. Providers are averagely knowledgeable on integration, but they have good attitude to the system. This can be enhanced by retraining, which is very crucial for the success of integration system. Providers are knowledgeable on integration with good attitude, and there are some identified challenges that must be urgently addressed, like the issue of training in the state and in the country generally must be looked into for the integration services in the state and in the country generally to improve. Other recommendations, identified challenges should be addressed. Further research on the study is also recommended. These are the references that can assist in further analysis of my presentation.
Thank you, Tomori.
Thank you.
Thank you, Tomori, for.